Putting off joint replacement is a goal of many patients, and that's very understandable because there's a lot of stress involved with making the decision. However, patients that put that joint replacement off, they just lose quality of life days. Day-to-day, people find with arthritis that they just can't do the things they want to do, love to do, and sometimes arthritis bothers them at a level it just makes them not happy. So making that decision to go forward with the joint replacement is, I know, very difficult. The way that I help patients make that is I tell them to go with their gut. If they're giving up so many things on a day-to-day basis that they just need an upgrade, I think joint replacement is the right answer. And I'm happy to answer any questions they have, to talk them through the process. And I do this every day, so it's very normal for me, but I recognize this might be a once-in-a-lifetime issue for them, and we treat them in the manner that helps them the most.